Hello, so my name is Hart, and I'm going to present today on how to maintain strength, fitness, and a healthy lifestyle after competitive sport, but also after any injury as well. So this is applicable to lots of different situations that you might find yourself in. And so what I'm going to talk about is how being fit for sport is really being fit for life. If we're fit for sport, if we have the health, the fitness, and the strength for sport, and we can continue playing sport for as long as possible, then really that is the same as being fit for what we need for life and for health. And so when we look at the difference between elite athletes or a competitive athlete and those that have retired, it's very interesting to see that actually the bit that we've struggled to maintain after sport is actually the skill component of sports. So it's the agility, it's the speed, maybe the throwing or the specific qualities of when you're playing that sport that we lose. But what we can actually see in this study is that retired athletes and elite athletes actually have the same physical test numbers, even though they've been retired from the sport for a number of years. So what we see is that upper body strength and maximal strength in the upper body, as well as running tests, are the same in those who have retired as those in elite athletes. And that's really positive because they're the key areas for us, people who don't necessarily play sport anymore. They're the bits that we want to know about because they're the ones that are going to influence us, our health and our lifestyle. And we need to know what we need to do after sport, whether it's GAA, soccer, football, cricket, what we need to do to maintain a healthy lifestyle and maintain as much of our physical fitness as possible and how that relates back to our health. So the World Health Organization about 4 years ago changed their recommendations. So now they have a couple of different recommendations that didn't used to be there. So we still have the usual 150 minutes of light activity. Well, often we would already get this in our sports. When we leave sport, we probably need to find something that's going to replace this 150 minutes of light activity, 75 minutes of vigorous activity, and 2 strength sessions a week, along with minimizing our sedentary time. Now, sedentary time really is the big problem at the moment. With the COVID lockdowns, with people working from home, people have a much higher increased sedentary time than what they had even a year and a half, 2 years ago. But also this is a problem often after we finish playing sport. So usually if we're playing team-based sport, and in Ireland it's very, very popular with GAA up until our late 40s, we might be out of the house 6 hours during the week, 2-hour training sessions 3 times a week. And so when we stop playing, we're getting a huge increase in our sedentary time if we don't find something to replace that with. But also if we put work from home on top of that, then we're definitely looking at a bit of an issue, and we'll discuss that later. So what I would like to talk about today is 3 key areas: strength and power, cardiovascular fitness, and then we're going to touch on the role of BMI and body fat on your health, fitness, and wellness. So I'm going to start with strength and power. Now, the reason I'm going to start with strength and power is because this fundamentally underpins all the other qualities we're going to talk about, and I'm going to show you why. So when we look at strength, muscular strength is a big predictor of all-cause mortality. So a study done in 2 million men and women found that those who were stronger had significantly decreased risk of all-cause mortality, essentially decreased risk of death by any kind of disease. And so it was the biggest factor that played a role in reducing people's risk. And so what we want to know is how can we maintain our strength as we age? And why is that then important? So what we can see here is on the left, on the top side of the screen, we can see that a 60-year-old woman has the muscle mass there, and the black part or the darker part is the muscle mass. The whiter part is the fat mass. On the right-hand side, we have an 80-year-old woman, and again, we can see that dark mass being the muscle mass and the white being the fat mass. And what we want to do is we want to try and maintain as much of that darker mass as possible. And you can see on the graph underneath, we can see the slope of the line is the drop-off in the amount of muscle that people have as we age. And what we want to try and do is we want to try and minimize that drop as much as possible. So we want to try and get that line as flat as we can. And in some cases, even increasing. If you haven't done much strength training before or fitness work before, you might actually see an increasing line as we age. And the flatter we can get that line, the healthier and the lower our risk will be as we age. And so this doesn't have to be the case. You don't have to lose that muscle. What we can see here in a brilliant study done by Robalewski, who used MRI imaging to have a look at people's quality of muscle, they found that in a 40-year-old triathlete, they had a great muscle mass with very small amounts of fat mass. And if we compare that to a 74-year-old sedentary man, we can see that that fat mass has actually started to almost invade the muscle. You can see the white mass in between that darker mass, but also we can see that increased concentration of white mass around the muscle. And if we then compare that to a 70-year-old triathlete, we can see he almost has the same quality of muscle mass as the 40-year-old triathlete. And the best way for us to do this is through strength training. So whilst endurance training will also play a significant role, if we can keep strong and do some form of strength training throughout our lifetime, we can maintain that muscle mass. And so what's the best way of doing this? Well, we can see from this study here that looked at the difference in maximal isometric leg press and maximal bench press over a 21-week period, that the strength and endurance group that's circled there in blue had the best results. They had over a 20% increase in 21 weeks, which is absolutely fantastic. So while strength is important, it also shows that strength and endurance strength is important as well. And the combination of the two, like we're going to speak about tonight, is the way to get the best results possible for yourselves and for anybody after sport or returning back to exercise after an extended period away. And then I wanted to touch on why strength training is important for a lot of our conditions as well. So I think, as Mark spoke about earlier tonight, obviously ACLs are a key kind of risk in field-based sports. We see them a lot in GAA, soccer, rugby, and other sports as well. And so I'm sure many of you may have had maybe an operation on the knee, maybe had meniscal issues or ACL issues. And so what you really want to know is, okay, what can I best do to help prevent any further issues down the line for my knee? And what we found that in those with osteoarthritis, which can be a common complaint maybe after knee surgery or after having any knee issues down the line, is that the people who increased their strength had a 22.5% reduction in pain and had a 17.5% increase in their function when they already had knee osteoarthritis. And this will only be better if we start sooner. Also, we found for those who had improved quadricep strength, who already had knee osteoarthritis, found that if they improved their quadricep strength, they had significantly improved gait and movement patterns afterwards. So that then brings me on to how strong is strong enough, and what do you need to do, and how can you quickly and efficiently see whether you're strong or not? Well, this test looked at a leg extension versus a sit to stand. And there's a really good test that you guys can all do at home. So what you do is you take a seat where your knee lines up with your hip, so about 90-degree angle. So a kitchen chair will usually be perfect. And you have to see how many sit to stands you can complete, full sit to stand, so sit all the way down and stand all the way up in 30 seconds. And if you can achieve more than 11, then you're above that kind of poor side of things. So if we're below 11, that shows you need to do a little bit more work, okay? If we're around 15, we're around hitting the averages. And if we're doing 22, we're into a good position. And the younger we are, we might want to push that even a little bit further. So up to 27 is a really good result. If you get 27 plus, you're excellent. And so it's a really easy test to have a look to see where you're at. And we have other tests here at the clinic that we have in the fitness lab, where we test this in even more detail and also look at the differences between your left and right leg. Really important for those who have played kicking sports and field sports over a long period of time. So that's a really good test you can do at home. But what do we suggest here at the clinic? Well, for those of you that go to the gym, we would suggest that you try and achieve a front squat of about 0.5 to 0.75 times your body weight. So let's say you're an average of 80 kilo male. You want to be aiming for about 40 to 60 kilo front squat. And this is the same across gender. So female and male should have the exact same according to their body weight. A wall hold, if you don't like to go for the gym, is a really good substitute. And 4 times 1 minute is the minimum target you should aim for. And you want to try and maintain that for as long as possible. It's a fantastic exercise. And a leg press of 1.5 to 2 times body weight would be another good alternative as well. For our posterior chain, so the muscles at the back of the body, our lower back, our backside, and our hamstrings, a deadlift of 1 to 1.5 times body weight is brilliant. And a hip thrust of 1 to 1.5 times body weight equally is very good. And then lastly, for our upper body, which is really important for females because of osteopenia, osteoporosis, and we see a decrease in bone mineral density as we age, the upper body is really important. So 8 to 10 good quality push-ups would be absolutely fantastic for both males and females to aim for. Between 1 and 3 pull-ups would be a brilliant aim or a brilliant target, especially for most females. If you can get 1 to 3 pull-ups, that would be absolutely fantastic. And if you don't have access to a pull-up bar, then pulling something with 30 to 40% of your body weight, so a dumbbell row, a cable row, a band with lots of attention, that would be about 30 to 40% of your body weight single arm, would also be a brilliant aim to try and achieve, and would really try and minimize those effects of osteopenia and osteoporosis later in life. So now we're going to move on to aerobic fitness and physical activity and the role that they play in your health and fitness. So why are they so important? Well, VO2 max is something that we use to test your fitness. So we use it here in all of our health and fitness tests. So every health and fitness test at Sports Surgery Clinic has a VO2 max because we see it as vital and most vital test to know your risk, but also how healthy you are. And a Finnish study that followed approximately 2,000 males with no history of cancer for 16 years found that if you have a VO2 max above 33.2, and a lot of people who have Garmins can get this number off their Garmin as well, it's not as accurate, but it's still a good proxy, resulted in a 27% less chance of getting cancer and a 37% less chance of dying from cancer. Those who done 2 hours of moderate exercise reduced cancer death risk by 26%, again, a big increase. And an improved VO2 max decreased the risk of lung, gastrointestinal, and prostate cancers. Moving on to dementia risk, which is a big topic at the moment, we find those with moderate to higher fitness have a massively decreased risk of dementia. And so we see for every 3.5 mils of oxygen, which is roughly about between 7 and 9% improvement for the average person in their fitness, they get a reduction of 14% in their dementia risk. And for those who already have a moderate to higher cardiovascular fitness, they have a greater than a 50% reduction in the dementia mortality risk, so death by dementia. So there's a lot of significant health reductions that come from having a higher VO2 max and therefore a higher fitness level. Lastly, and this is the one that we most know about, is that if we have an increased fitness, we have a reduced risk of cardiovascular disease. So if we have a moderate to high fitness, we have a 53% reduction in the risk of cardiovascular event or heart failure, and an increase of just 9% in our VO2 max decreases the risk of, or decreases our levels in our blood pressure and our cholesterol, two key markers. So if you do have issues with blood pressure and cholesterol, getting fitter will significantly help alleviate those. And so we know that we need to change it. So how do we go about doing that? We want to improve our fitness. So how are we going to do it? Well, the first rule that I have is take care of the basics. So this is the first step that we take with our patients. And what I mean by that is take care of your daily steps. So what we can see from here is that anything after 6,600 are roughly around about 7,000 steps. There's a big risk reduction. So we can see that line drop significantly between 1,600 and 6,600. But after that, it starts to level off. And what this study showed was every 1,000 increase in steps per day had a decrease of 23% on your mortality risk, essentially your risk of dying. So getting over 7,000 steps every day has to be your first priority. So if you're someone who's finished sport, or maybe has had an injury, or has had a very stressful job over the last year and therefore has dropped away from maybe being as physically as active when sports shut down, they kind of dropped off. Well, getting your steps in is the first kind of port of call, and getting over 7,000 will be the main aim, really. Number two is just to start, and start now. And better yet, it probably would have been better if you started yesterday. So what we see is that people who do lifelong exercise have a significantly improved kind of status in older age. And that those who do some form of exercise, whether it's hard or easy, get the benefits over the long term. So someone who does lots of very intense exercise for maybe only 10 years, but then drops off, probably doesn't have the same health advantages as someone who does a moderate or even low amount of exercise, but over a long amount of time. And what we can see here on this study is that red line is the line of independence versus dependence in older age. And what we can see is that this white cohort in the white circles, they're the people that have done lifelong exercise and purposeful lifelong exercise. We then see the people in the gray, those that have done lifelong exercise and just at a moderate level. And then those that are in the black dots are the older but still very healthy people, okay? And what we can see that even when you're old and healthy, you're only just above that independence-dependence line. However, if you've done lifelong exercise, you can see how you are way above that line. and there's a much bigger gap between independence and dependence. Now, this is really important because as we live for longer, we want to be able to do what we love for longer as well. And what we don't want is we don't want to be living longer, but being dependent on other people. And a great way to try and prevent that is to make sure we're doing some lifelong exercise, starting from our 20s and 30s, or even 40s or 50s, and then continuing that all the way through. And it can make a massive impact to the life that we can lead when we're 70 or 80. So rule number 3, and the final rule, is intensity over duration. Now, if you do run 10Ks, if you do like to do marathon training, I absolutely would not stop. But there are some very interesting findings. So what we've found, or what previous studies have found, is that if you do some high intensity training, even just 60 seconds work with 75 seconds rest 10 times, and you do that 3 times a week, in 5 weeks, you can have a 10% improvement in your VO2 max. Now, we saw before that a 9% improvement significantly reduces your cardiovascular disease risk, significantly reduces your dementia risk, just by 10% improvement. And you can get that 10% improvement in just 5 weeks by doing some high intensity interval work that will only take you the guts of 20 minutes to do. So it really shows you how easy it can be if we continuously do it over a steady period. And then secondly, what was found was that increased rating of perceived pleasure was higher in high intensity training than in continuous training. Now that's really important because if we want to make this a habit and we want to do it for the long term, we need to make it efficient and we need to make it enjoyable. And what they found was that even though people worked harder doing the high intensity training, it was much more enjoyable for them. So shorter amounts of exercise, but with higher intensity, seemingly give us the same, if not improved results over continuous training. However, continuous training does have lots of benefits and lots of mindful benefits as well. So it's not that we're saying if you're doing continuous training, you should stop and change, but you might think about adding in some high intensity training into your training program as well. So then finally, we're going to move on to body mass index and body fat percentage and the role that it plays in your health and fitness. This is the one that's spoken about in the newspapers the most and is all over social media as well. And there's some interesting findings. So we do find that in the studies that obviously those with a higher BMI and higher body fat percentage do have a slightly higher or significantly higher risk of all-cause mortality. And we do see that in some of the cancer risks, it does go up when our weight increases and our BMI goes up. However, these are big studies taken across wide selections of the population. And so there are some other factors that we need to account for. Just before we move on from that though, what I would like to talk about, and specifically because Mark was talking about ACLs before us, is that those with osteoarthritis, which can be slightly higher risk if we've had a knee operation, if we've had meniscal pathology, or we've had an anterior cruciate ligament injury, we do find that body mass is really important for those people. Okay, so what we find is that if you have osteoarthritis or if you have had significant surgeries to your knee, it might be a good idea for you to try and maintain a fairly lean body mass, because what we do see is for every 1 kilo you're over what your body mass should be, we see a 4 kilo increase in the compressive load in your knee. So for every 1 kilo you lose 4 kilos of compressive load on your knee. Okay. And for those who lose on average about 5 kilos, we see a 50% reduction in their osteoarthritis risk. And even if you just lose 10% of your body mass, there's an 28% reduction or improvement in function. So coming back to BMI and body fat, well, it's a bit of a red light moment, okay? So whilst the social media and the newspapers say that, BMI is the be all and end all, it really isn't. Recent studies have found that actually people who are powerful and who are strong exhibited a reduced 9-year difference in their life expectancy. And that was including BMI, waist circumference, and body fat percentage. And what they found, they split people into 4 groups, and they had powerful but overweight, powerful and lean, and then they had lean and weak and overweight and weak. And what they found was actually the people who were powerful had much lower risk than the people who were weak. So if you were overweight and powerful, you had a significantly decreased risk versus those who were weak and lean. So actually being powerful and being strong, but maybe being slightly overweight, was not as bad as if you were weak and lean. And so it really does kind of go against just using BMI or just using body fat percentage to tell us how healthy you are. It is significantly more important for you to be strong and fit, but slightly overweight, than being lean and maybe trim, but not strong and not cardiovascularly fit. And I think that's a really important message that gets missed in the current public information that's out there. So it's really important for you to be strong and cardiovascularly fit, but a little bit overweight. You're in a much better place health-wise. So that brings us on to then, what should we be targeting and what do we want to do? Well, shock horror, the World Health Organization is pretty much bang on the money. So if we can do 150 minutes of low intensity exercise to try and replace maybe those couple of hours that we've missed during the week due to sport, golf is a brilliant example of where you can get 4 hours of low intensity exercise straight away. If we can include some vigorous and moderate exercise every single week, so that high intensity training that we spoke about, 1 to 2 sessions of that a week, if we're getting our low intensity exercise, would be great. And if we're not getting our low intensity exercise, maybe 3 sessions of that a week, maybe at the end of your gym session for 10 to 20 minutes would be a brilliant way to bring that in. 2 strength sessions a week is absolutely vital. Remember, strength underpins everything. So strength allows us to keep doing what we love for longer. So that's going to keep us playing golf into our older age. That might keep us on the 5-a-side court for another 10, 15 years. So it's really important you stay strong, because that's the one key area that underpins everything else. If we're strong, we don't get as many injuries. If we don't get as many injuries, then we can carry on doing what we love and the physical activity that we love. A little bit of balanced mobility, including a good quality diet. So 80% of the time doing the things that you know you should do, taking the right decision, so that 20% of the time you can have the glass of wine and maybe the pizza on the weekend that you want. But if 80% of the time we're doing the right things, that allows us to have that 20% of the time where we're maybe not doing quite the right thing. And then getting those 7,000 steps a day. We saw that massive drop off after 6,600 steps in our risk. So if we can get 7,000 steps every day, especially if we're working from home, that's probably the most important. If we're working from home, 7,000 steps is actually quite a task, and we really need to focus in and get that. Then that's brilliant. Now, for all the things we've spoken about tonight, we offer a fitness health lab here that is covered by both VHI, Irish Life and Leia. So please have a look in your policy, because we can do all of the testing and give you all the information that we've spoken about tonight in a report and give you personalized suggestions and personalized programs to help you with that. Alternatively, VO2 max testing is the absolute vital test that we would suggest for everybody. It gives us a brilliant window into where your health and fitness is. And we can conduct them on site here in the Sports Surgery Clinic. So if you're interested, please let us know at fitnesslabs@sportsurgeryclinic.com, or give us a ring on 01 526 2050, and we'll get back and give you some information regarding the VO2 max, which can really give us a great insight into where your fitness is at currently and your risk going forward as well. Thank you very much for your time. And if you have any questions, I'll be more than happy to take them after this. Thank you.
Thanks, Luke. We'll all be doing our 7,000 steps now after watching that. So first question is from Con. He said, I only have a limited time to train. Should I prioritize strength or some form of cardio?
So I think, as you kind of saw in the talk there, I think strength really underpins everything that we do.
Yeah.
So if we can stay strong, it allows us to do all the things that we really love to do, whether, that's playing 5-a-side football, golf, tennis. So strength is definitely a key quality. So I think probably some part of the week should be dedicated to strength, but we only really need at least 1 session a week to really stay strong. So the rest of the week can kind of be prioritized to maybe a bit more cardiovascular. So I think we definitely need to have some strength in there, because if we don't use it, we lose it. But probably cardiovascular is also very important. So probably a 60-40 split is a really good way to kind of go about it. But it also comes down to what you enjoy and what you love as well. So if my time was limited, I would probably look to do 1 strength session a week and maybe 1 to 2 cardiovascular sessions a week. And that's a really nice split then.
Lovely, thank you. This is a question from Mia. How long after a knee scope in SSC would I expect to be able to play sport easily again? And will the pain go away following the strength and conditioning program?
Really good question. So I think this depends on what you have done. So not every knee scope is the exact same. Yeah. So I would tend to say you probably want to get back to full sport and competitive sport. You might be looking up to 3 months, depending on what you've had done. You can definitely get back to certain activities quicker than others. So it does depend on what sport you play. So if it's a multi-directional kind of court sport like tennis or field sport, you might be looking at slightly longer. Whereas if it's more linear based, such as running, it might be a little bit quicker. And strength and conditioning is going to play a huge role in that, because we know that after the operation, you'll probably lose maybe 10 or 20% of your strength quite quickly. Whereas if you introduce a strength and conditioning program early, we can get that back much quicker as well. So it definitely depends. I would say I'm being more cautious on that kind of 2 to 3 months side. It might be a little bit quicker than that, but to get back to full field sports, you might be looking at the kind of the 3-month kind of stage.
Okay, thank you. Owen O'Neill, what pace of running is needed over the 60 seconds?
So I think it's individualized to everyone. So what I would say is over the 60 seconds, you want to be working quite hard. So we use a concept called rating of perceived exertion. So how hard you work. And you can quite easily track it from 10 being like what pre-season would be like really, really hard. And 1 being pretty much you just getting out of bed in the morning. And if you can kind of be around a 6 or a 7 for that 60 seconds, so you're working about 7 out of 10, then you should be getting all the benefits. If it's a little bit too easy, then you might miss a few of the benefits, but there's absolutely no need to push it to 10 or 9 or 10. So that kind of moderate to high intensity is a kind of good level. And in terms of speed, it really is individualized.
Okay. Can you overdo your sessions in a week?
Yes. So the analogy of we're a cup and we can only fit so much water in the cup is definitely true.
Yeah.
So if we do too many sessions in a week and don't provide enough recovery, then that is when we can kind of get overtrained, we can experience burnout, or we get a soft tissue injury. So recovery is really important. It's probably one of the things that we see least programmed into people's kind of training. When we train, we're actually breaking down muscles. When we recover is when they get stronger, better. And that's the same for cardiovascular fitness as well. So it's really important that when we train, we give adequate rest so that we can actually improve and get better, because that's when the kind of magic happens, really. So we tend to say at least 2 rest days in a week, ideally, where you're not doing too much at all to allow you to recover. And that does depend on people's training history as well. Some people might be used to training a little bit more, in which case they can handle that, whereas other people, you'd want at least 2 dedicated rest days in a week.
Okay, good, thank you. Sergey, do you recommend protein shakes for recovery, best diet for recovery?
Yeah, so protein shakes can be very handy and they're readily available quite easily. So that's good. I would really just see them to supplement your nutrition though. So you can't really use them to replace good nutrition, but they are very handy to supplement what you do and to have them on hand. So immediately after or within half an hour after a training session is a really good window to take in protein. So protein shakes, I would definitely recommend them if you want to utilize them. But having said that, the evidence is there that chocolate milk or a high protein chocolate milk like Avamore that you can buy off the shelves is just as good in some cases for most people. So it doesn't have to be used, absolutely, but it can be something that can be definitely advantageous to use.
Okay, thank you. Etna said, should I be doing weights 50 plus? I think when she's over 50.
Yeah, absolutely. Actually, that's probably the time where it's most important. There's some brilliant benefits to bone mineral density, to tendon and tendon health. For anyone who's experienced osteoporosis or osteopenia, we see brilliant benefits. So there's absolutely no contraindications to doing weights over 50. The only thing is you just see really good benefits. Okay. Obviously, an individualized program would be important if it's something you haven't done before, but there's absolutely no contraindications to doing it over 50. Okay.
Look, Lisa McDaniel, she's just talked about her son there. He had a large osteochondral defect in his knee. Get it fixed. He's 11 days post-surgery, nearly 5 weeks since the initial injury when he was put in a full brace. She's just concerned that he's a significant amount of muscle wastage. How can he prevent this?
So I suppose post-surgery, it's very hard to prevent because post-surgery, you are going to get a certain amount of muscle wastage. The most important thing is to try and get that muscle, that thigh muscle, the quadriceps back or activated as quickly as possible to minimize that atrophy. So there will always be some, but by doing some exercises, especially ones which are specific to the surgery and the injury, then we can maximize the amount of muscle mass we can retain. And that's really, really important that those early stage exercises are all there to maintain muscle mass and trying to get that joint moving as free as possible as well. So I think if they can do some exercises which really encourage that muscle to activate and stay, then I think they'll be in a brilliant position. But you will have some atrophy. So it's just trying to maintain as much as possible with exercise and try and kind of stop the atrophy as best as you can.
Yeah. Holly's asking, do all health insurances cover the fitness lab testing and how would she apply?
So it's all on certain policies. So Layer, Irish Life and VHI all cover the fitness lab, but it depends on what policy you're on. So the best way to go about it is to check your policy and check your pack. Usually the benefits like the fitness lab are down towards the end of the policy. But if you're unsure, you can contact us here at the fitness lab at Surgery Clinic and we can check the policy that you have and see whether it's a benefit you have. Or you can ring your health insurer and see as well if it's a policy that you have on your plan. And that's probably the best way, because lots of people have it in their plan, but they just don't see it because it's right down the bottom. So if you check your plan or your documents, you should be able to see if it's there.
Great, thank you. Derry O'Toole, what is the best level of fitness you've seen people who've had knee replacements? I'm 52 and having a replacement on the 11th of December.
We see people get back to some really high level kind of activities. We've seen people get back to golf in really quick times. We've also seen people get back to quite dynamic activities as well. Obviously, initially, your non-impact activities are going to be the ones that you get back to. And there's no limit really to the level of fitness you can get back to, because obviously something like cycling, you become very, very fit, but actually puts very little impact on your knee. So we've seen some very fit people come through. And I think really you're only limited by your ambitions. There will be some activities that you might find a little bit trickier to do, especially initially, but really there shouldn't be any limit. So however fit you are now pre-surgery, you should at least be able to get back to that post-surgery, if not a little bit better again. So there's definitely no limits that you should be placing on yourself after knee surgery.
Right, I think this will be the last one. Sunita, would you recommend a 45-minute Pilates class as a strengthening method, or is that more balanced conditioning?
Yeah, great question. I think it does depend on the Pilates class that you do. But generally what we would say, especially to see the benefits in bone mineral density, we want to really see something that's over and above our body weight. So whilst Pilates is definitely a good workout and very, very good for your health, it's probably not quite taxing enough or has enough resistance to necessarily influence, say, bone mineral density and other areas. So I think it's a very good workout, but definitely something a little bit above that. And you'd only need something to supplement it. So it might only be 2 or 3 exercises to supplement what you do in Pilates, would then give you all of the benefits. Whereas Pilates alone might just not be enough to really stimulate the muscles and the bone mineral density side of things quite enough. So that would be the only thing. And it depends on the class. You can get some quite more relaxing based Pilates classes and some which are very, very hard. So it just depends on your class and on your instructor as well.
Luke, thanks very much for joining us tonight. So